the website, but we have retired Judge Carol Scott Berry, formerly with the Phoenix Municipal Court, Neil Giuliano, President and CEO of Greater Phoenix Leadership, and the new director, I'm so proud, of the Arizona Healthcare Cost Containment, Carmen Heredia. So I'm going to start with a couple of questions for all of you to answer, and then I've got some specific questions, and we may get questions from our gathering here. So let me start, Carol, with you. What is your thought process, and how would you define equity, and why should it matter to everyone?
Well, I thought a lot about this in preparation for here, and I thought about equity as every person is the same but different. And I thought about it in the context of learning styles. All of us learn differently. Some of us learn by hearing, some of us learn by individual study, and some of us learn in a group. But we all learn differently. And so if you look at equity in that sense, to have a good educational curriculum, we have to have a curriculum that deals with all of those learning styles. And an organization that I teach in called Bible Study Fellowship International, we have a fourfold approach to learning. One is to independent study. Then you have a group discussion about whatever it is that we're studying. And then there's a lecture on whatever we're studying. And then there are scholarly notes that you read independently. And so you have all these different ways of getting the same information. And so when I think of equity, that means that we have all these different ways for each individual, however they learn, to get that information. So that means that not only do you have equal access to the information, but you have access to how you learn. So that is
So it's understanding people's differences,
yes,
but still making sure that everybody gets access or learns the information you're trying to impart.
correct.
Carmen, what about for you?
Yeah, I think it's about acknowledging differences. So here we're all different. We're different ages, different genders. We came from different communities, so our perspectives and walks of life are inherently different. And that shouldn't, be a bad thing, but acknowledging it really gives us the ability to shape how we provide things in the world, small scale to policy and large scale, by acknowledging those needs. And I think that the word equity is often confused with the word equality. And to talk about that a little bit, I simply define it as equality is giving everybody tools. We would all get resources, but we might need things differently. And so getting specific tools, based on what my need is and what I come to the table, what might be a gap I need to fill is equity to me. And I think the report is fantastic, and I'm so glad we're doing this.
And your perspective?
Sure, thank you. First of all, your intro reminded me my first town hall was in 1982, which obviously I was in grade school. But tremendous volunteerism with it, and I served on the board for a few years also. So great organization, happy to be a part of this. So I think about it this way: equality is that all of us, the three of us on the panel here, we're all here. We're all sitting on similar couches, right? Equity is that we all knew before we got here what this was going to be about. If it was not equitable, Carol and Carmen might have gotten all the background information, knew about the report and everything, and maybe I didn't know what I thought maybe we were coming just to have a little conversation, right? So it really is about what takes place before equality. Equity are the resources, the background, the knowledge that puts people on the same couches with the same information.
So one of the misperceptions of equity oftentimes is described as just a redistribution of wealth. So how would you respond to someone that was saying that? How would you couch that, why they might think more broadly than that?
Yeah, well, I don't see it as a redistribution of wealth because you're not talking about something that is kind of quantified in that way because it's different for everyone. What Carmen may need, what Carol may need, what I may need, what someone watching this may need, it's all going to be different. So equity is the understanding that you may have to do something to ensure that everybody is able to participate in the same way. So I'll use the example, and I'm sure a lot of people have seen this, the little meme of the 3 people peering over, you know, the fence, right? Right, and equality is that everybody's on the same box, but the shorter person still can't see. Equity is that a really tall person who doesn't need the box gives it to the person who can actually, so everybody can actually see what's on the other side of the fence. That's how I think of it.
And we talk about just removing the fence.
Well, that would be nice too, but not always easy. Yeah, I appreciate it, yes.
So, Carmen, from your perspective.
I think it's an unfortunate misconception, misunderstanding of what the goal, the intent is. It's not about taking away, I don't see it that way at all. It's about addressing how things come to be. And when you deploy an initiative, a service, a funding, are you doing it in a thoughtful way? Is it the best way to do it? Are you considering all these factors? And so it's really about that. It's not about taking away and redistributing.
Carol?
And I think too, I really love Neil and Carmen, and I think also has this premise in, there's none of that there's a scarcity. And so when you come with that fear of losing, you miss out on an opportunity of inclusion. And I also think it takes away that it doesn't recognize that one size does not fit all. And so when you recognize that one thing is not going to be good for everybody, then you think in a bigger scope, and you actually have a better product, a better situation, have a better city, a better state. When you recognize that we are different, and that's okay. And there is enough Arizona here for all of us, that nobody needs to lose because somebody else is included. And I don't know where we got that thought pattern that when I gain, you lose, or you gain, I lose. And so I think it's a matter of changing our thinking about what's available for us. It's enough Arizona here for all of us.
I often talk about with my team, I am the conductor of the orchestra, and I need the diversity of interests or instruments in order to have the best orchestra I can have. And so I don't want all trombones or violas. I want the mixture because that gives the beautiful music. And I kid my staff by saying sometimes we're flat or we're off a little, but when we're together, we're making beautiful music. But it is the diversity of the instruments that makes music so incredibly beautiful. So that is one way to look at that is that is additive, not subtractive. Let me talk, so Carmen, you've been in healthcare for a long time. How have you, let's talk about equity in healthcare. And do you have any examples where you've seen either cost savings or better quality of care when that equity approach is built into healthcare?
Yeah, absolutely. So that has been, I mean, it's kind of my career and passion is this very same topic. So there are plenty of examples. Speaking from where I am now at the Arizona Healthcare Cost Containment System, which is the largest insurer of the state, focusing on the underserved, the lower income population in the state, serving 2.5 million Arizonans. You have to think about this. Think about this topic very, very much so. Robert Wood Johnson Foundation several years ago published a very notable report about how the zip code that you live in affects your health outcomes, and really what it points to is social inequities, or we don't want to talk about inequity too much today, right? We want to be positive, but just to acknowledge that there are disparities that lead to health outcomes that aren't always positive. So addressing that is an initiative that in public health has been happening for years, where it's discussed a lot. to, probably look at, you know, are we missing the boat in any area? Are we doing it comprehensively, and are we, you know, maybe doing it in a way that's effective in what we implement? You know, everyone has their initiative, and are those initiatives effective? We're getting ready to access to launch the Housing and Health Opportunities program, which is part of our waiver. We operate based off of a federal waiver, and this results in $500 million that we'll be releasing to try to address housing needs. And we're a health care reimbursement program. So you wouldn't think normally that housing is healthcare, but we're, you know, in many programs across the nation really making that connection that if you don't address housing, you can't get to a healthier lifestyle and address other needs. And so this program will cover 6 months transitional rental assistance, you know, for the next 5 years, and I'm very much eager to get that going.
I once read in Health Affairs that a patient said to his physician, if you really want to help me with my blood pressure, help me with my utility bill, because if it's 90 degrees inside my home, you can throw all the medicines at me you want, and my blood pressure is not going to go down, because it's an inherently different stress.
And hierarchy of needs, right? And you don't have shelter, how will you focus on something else?
And I know some of the research done, because we helped finalists to put some of this together with access, that the combination of housing and healthcare and wraparound services ended up saving money. I know you had a focus on the seriously mentally ill population, and you were able to see, I think it was like a $5,500 per member per month savings and better quality of care. So that's one of those benefits, that if we can improve the care and reduce costs because we're increasing efficiency and we're going upstream, we can achieve, reduce that disparity between life expectancies. So I think that's a win-win. So from your livelihood as being a judge in the justice system, have you seen examples where you've seen disparities in equity, but also we've had some very innovative solutions, I think, in the court system kind of popping up. So can you speak to some of that?
One of them that's really in the forefront now is access to justice. The public generally believes that they can't afford to wait, and so they will put off seeking assistance, asking the right questions, and until they're in a really bad situation and they have no choice but to try to seek out legal counseling. And so there's a lot of steps being made by the Arizona Supreme Court, by the state bar, to address that concern. And one of the main issues that come out of those discussions is the creation of a paraprofession. And what they do, they're not lawyers, they cannot represent you in court, but they actually have legal training and they can help you prepare for court if you have to go in by yourself. So they'll help you with your documents, give you resources of where to go to get certain things that you need, tell you what you need to bring to court with you, who you may need to bring to court with you, how to present documents, and those kind of things to help people have access to justice. A lot of times people most people who come to court are there because they want to. They're in a bad situation, they're in a divorce, they're being sued, they're being charged with a crime. And so they're already in a traumatic situation. And so they don't know, you're told, well, get a lawyer, my resources are limited, I can't get one. So now what this does is help to address that, so that everybody can have some access to getting a justifiable outcome in whatever case they're in court. And the state bar has started state bar and the Supreme Court, a program where they certify these document preparers or professionals so that there's oversight, so that the public is not taking advantage of by these people doing it.
And one of the examples in the report that I think you're a part of is the Arizona Legal Justice Alliance. You want to talk a a little bit about that?
Yes, what Carroll's Equal Justice Alliance is a collaboration between members of the state bar and the ASU Center for the Study of Race and Democracy. And that came about after, the murder of George Floyd in 2020. We were all isolated. People wanted to talk. They couldn't talk to people because we were isolated. And, we came up with the idea of basically just having a conversation, a dialogue about these social justice issues among lawyers and judges, and it was virtual. And what we found from that outcome, and basically what happened was, the state bar, with, 11 members gathered up what we call our affinity bars, and that's the Asian American Bar Association, the Black Lawyers Association, the Hispanic Bar Association, the Jewish Lawyers Association, the Women Lawyers Association, I guess you just know that we have all of these associations, Iranian Bar Association, the
Everybody's got to-
everybody, all these people came together because we have a common interest in doing that. And it was just amazing to have that dialogue, and what we learned from that is everybody wanted more time to talk, and more time. And so we started this alliance, and we've been having these dialogues since 2020. We've come up with ideas on how the bar can do better, how and what the Supreme Court can do. And so it's just really snowballing in something. That's one of the reasons I'm here. The former president of the town hall attended one of our sessions and invited me to come to speak on the issue of equity before the town hall. And so it's still snowballing as to how far we're gonna go, but we've had some very positive outcomes, and we're looking forward to making contributions to the state bar, to make it more equitable, to make it more inclusive. And it's amazing what collaboration is. When we bring people together with the same ideas, same purpose, and same goals.
Absolutely. So let's turn to the business community. You had your world in public service and other nonprofit management, but now you're the CEO of Greater Phoenix Leadership. And full disclosure, I serve on his board. Can you talk about why equity is valuable on the business, from the business perspective? And I know we've had some good conversations, even looking at national best practices.
Yeah, great question, and I really appreciate this part of the conversation, because it impacts everyone. The folks who want to divorce themselves from business to address any issue don't have an appreciation. I mean, everything we see right here, from the jewelry we may be wearing, to the clothes we are wearing, to the furniture we are sitting on, to the camera that is viewing us, is related to a business. The product in our hair is related to a business, right? Everything, so that we can't divorce business from these really important vital topics. So let me make this statement really clear, because the business community is a bit in the middle of what's going on with regard to this topic nationally, in some states more than others, but it's high profile. The work of business and enterprise is not about the wars and clashes within the culture, right? The wars and clashes within the culture are taking place and utilizing the business community and pointing fingers at the business community for whatever they may believe or however they may conduct their businesses. But the work of business and enterprise is about service, providing goods, providing products, providing opportunities, providing employment. And so why is that important? Well, the Greater Phoenix Leadership Organization worked with the ASU Knowledge Enterprise Unit in the President's Office to do a study for us on sort of the state of racial equity in Arizona. And it looked at education, housing, criminal justice, different aspects of society. Well, surprising no one, the state of racial equity in Arizona could be much better. And so this group of business leaders has decided, well, we need to come together and we need to start figuring out what's going to be the business community's role to address this. And we're just now looking at that draft and inviting other business leaders, anyone who's a business leader in the community that would like to be involved in this conversation, to put together a group of Arizona business leaders that will work on racial equity. And what is that really gonna mean? We haven't defined it because we want other people to come in and help define it. But here's what we know. Number one, it's the right thing to do. Number two, again, surprising no one, it's good business, right? So you have a combination of doing the right thing and doing what's also going to be good for further economic prosperity in our society that we cannot force ourselves on. We think that's going to be a win-win.
So Carmen, let me talk, you're the only group, or only person representing a statewide organization. And town halls, and you've been doing some great community meetings over the last several months, talking about the implementation of the housing program. So you guys are good at doing outreach around the state. What's your perspective on doing community town halls for that area, that Arizona Town Hall could be doing community town halls in these rural areas? How might your or your team help with that conversation?
Well, first of all, acknowledging it is a challenge to connect and I get a lot of folks that I meet with telling me that there's that, Maricopa County is the state or however it's put that a lot of things happen so centrally in the state and that rural communities are left out. And it takes more energy, more engagement, it takes presence. I think that even though we do a lot, right now we're still doing things very virtually and access to get out more and be present in communities, and it takes relationship building and listening. So I think that would be how I answer that, Suzanne, that that collaboration across what's available in each community is going to look different. But working with cities and working with local nonprofits and businesses and other groups, you have to get people to work together, form these coalitions that have been mentioned, based on interests, but out and specific to the community that is being served. And so that takes a lot of time and resources. You have to probably be strategic about it, but as a state agency that does the local state, love to invite us to this conversation.
And you talked about here the diverse groups. So how might community town halls, maybe each group has its own town hall or community town hall that have a conversation and then come together as a group, each having the experience, sort of the microcosm and then the broader. Are there other ways you can see from the legal system engaging in community town halls?
Yes, the idea of each individual group that's in our collaboration, I don't always do that. But I can see us collaborating and putting on a town hall, such as our organization, Equal Justice Alliance. And I can also see a collaboration with the state bar and putting on a collaboration. I don't know if we would just for lawyers, just how the town hall will do that, but I think it would be a wonderful idea to do that. I also thought about my church, which is the West Baptist Church, which is the largest African American church in the state, being a place for that. Our home neighbor, I'm very sad and all of openness of the city, because a lot of things happen. And so that would be a wonderful place for the town hall to have a session.
And what's great about over the last couple of years, because of the pandemic, some disruptions turned into good opportunities. We were able to engage more people. Nearly 2,000 last year were part of those community town halls, literally from all over the state. And over the last couple of years, there's been 25, sometimes 30 town halls over that 9-month period before we do the major town hall. So what's been great is people have said, we need to be in person, or we can't be in person. We want to be virtual, and yet we've been able to break up into small groups, have good dialogue, and the summary of that dialogue all then ends up in the final report. And what we've seen, the last couple of reports have said, here's what the Sedona Town Hall said, here's what the King team in the town hall said. And what was great is as they were given to elected officials, whether it's local or statewide, they're all turning to the page of their piece. Because they want to know what, so it had both the statewide perspective as well as their local perspective. And so it's been able to be beneficial in a couple different ways that our past reports were not able to do because we've dug deeper into those community town halls and community conversations. From a business community, are you seeing that there might be value in doing a business leader town or community town hall or series?
I think there would be, both in different regions around the state, but then collectively as well. Our sister organizations in Northern Arizona, Tucson, participate annually with us in an annual CEO Business Leader Summit. It takes place in the fall each year. So I think there will be opportunities, and these dialogues, these conversations are so important. I mean, we're not going to make any progress at all if we don't have these conversations and address these topics. So we're happy to be part of that.
Let me stop and see if there, okay, this is a permanent question. I've heard that almost 600,000 Arizonans are at risk of losing Medicaid coverage due to the rollback of COVID policy. What is the plan? To make sure people stay covered in the spirit of equity. It seems that many don't know that they won't auto-renew.
Yeah, great question, very timely. So unfortunately, this is a reality. In order to have Medicaid as a covered service, you have to qualify for it, which includes a screening on your income. In order to ensure, the clock is not yet, and we could always change those thresholds or do things to impact that. That would have to come from legislative changes and funding, really having the advocacy work in order to make a change like that. But under the current, thresholds and confines, we have to have a limit. We have to check for income eligibility so that the people that are in the program are qualified for it. And what's happening is the public health emergency ended, and during the time of the public health emergency, the disenrollment was not happening. It's now been lifted, and so we have to go back to that formal process of screening for eligibility, and that's where this number of 600,000 comes from. We don't think that all 600,000 will be disqualified. They're just the at-risk category. We've been able to auto-renew, or we will be auto-renewing over the course of the year. 80% of people that are on Medicaid, which is fantastic. That 600,000 are folks we can't auto-renew because we need to hear from them. We don't have a means to get a hold of them. They haven't been responsive. Or we have checked their income based on pings that are done with hubs that I can't speak to in detail, but we've checked that they're over income. Now, those over income folks, maybe they are over income because they're working overtime because of a workforce shortage. It's not their permanent situation, but that's how that ping came back. So that's what we really need to do our due diligence and have those conversations. There are appeal periods and different rules that really protect people so that they're not, disenrolled appropriately. So speaking of our plan, we've done a ton of effort to try to get the word out, and I really want to clarify that even though all of this started April 1st, it is not April 1st when everybody gets disenrolled. It's, we have to re-enroll 2.5 million people, and it's a 12-month process. And so we prioritize those groups that we do have that information about that income change to assess those individuals first. We've also tried to align households together so that households didn't have to go through this process multiple times throughout the year. So there are several individuals on Medicaid or the Arizona Long-Term Care Program. They will get renewed together and with their SNAP benefit data as well in mind.
And SNAP is food stamps.
Food stamps. So if you are getting requalified for that through the Department of Economic Security, having your medical benefit assessed at the same time makes a lot of media campaigns, billboards, radio, TV, marketing, working with our health plans, including Molina, today's sponsor, doing amazing work to get the word out. So robocalls, texting, individual phone calls. Some of our health plans have put advertisements in transportation, taxi vehicles, and grocery stores. So I think the word is out there. More strategically and tactically, we are that list of at-risk individuals. We're giving those individuals to our health plan partners and highlighting them as people that need specific outreach. And so we are working with community health centers and different provider groups to work individually with people. So we're doing our best. We've set up some call centers, and our tracking metrics are only started April 1st, and our data reports on this has to be publicly available. We published in May, and we'll see. I think that there are going to be individuals that we can get a hold of, trying to do our best to make sure it's very minimal.
And I can amplify that, because really when the Affordable Care Act started, there wasn't initially in Arizona a lot of support for getting the word out for that it was even available. And so Vitalist, among a whole bunch of other groups, created the Cover Arizona Coalition. And really over the last 10 or 11 years, we have this network of community health workers, and we said at one point it was sort of kept together by duct tape and baling wire, but it was, now there's a lot of support federally, and so, but there's a really good network in the community of people that are watching to how do we make sure people are insured. So whether it's the 600,000 or anybody that's eligible for access for the federal marketplace, there's free counseling. You can go to coveraz.org, put your zip code in, and get a list of free assisters. So they're trying to make it as easy around the state as possible.
Assisters to help you enroll in marketplace insurance, and that's the idea. If you don't qualify any longer, the hope is you qualify for your employer-based insurance or the marketplace insurance, and these groups are excellent partners.
So let me turn, Carol, if you touched on this about access to legal services aren't as equitable as they should be. Are there other things, whether it be diversion courts or other places where people are getting served in a different way to try and break down some of those barriers or address those inequities?
Yes, there are a lot of things the courts are doing to address a lot of different inequities. Previous municipal court has a mental health court, veterans court, and a homeless court. And sometimes that's one person. That's the veteran, he has mental health issues, and he's also homeless. And so those courts are created, we call them special courts, to address those issues that the regular court hearings do not address. And we have people who are trained to screen those people in jail, to recognize those issues in jail, so they are funneled into the right courts to get those services. Of course, there are people who fall through, but there is an active engagement in trying to find places for those. Those are throughout the country, extremely successful. Some other courts have domestic violence courts to deal directly with those issues. We have one as well to deal directly with those issues. Because a lot of times it's not just someone who just acting out or bad. That's how they really raise. This is how dad, grandma act, and grandma. So you get to address those issues individually, and what we see is adequate. And so those are very successful, and you can address a lot of those issues that are not on service, and that can't be addressed just in a regular course. It's that whole going after the whole thing, one side, just doesn't fit all. And so
very alarming. The data definitely points us in that direction. Good news, one thing that we can celebrate that we are doing is we just announced that we are now covering individuals that had gave birth 12 months postpartum coverage with Medicaid, and so
That was a legislative change that had bipartisan support in the legislature.
right, and so it started just now. So this is one of the means that let it not be access to your provider, access to your services, and access to care, the issue, to help in this area.
Let me ask, we have a question about what would be an equitable approach to rural or tribal Arizona, and how might that make the biggest difference, whether it be broadband or business loans? So we want to take a stab at that.
Yeah. Well, I think the one thing we know is that there is no one thing, and it's going to take a variety of interventions, very concrete interventions, very comprehensive interventions, and the business community will be involved with that, whether it's broadband, whether it's service delivery for healthcare, whatever else it may be. It's going to take a lot of work.
And there's been a lot of funding allocated
Yes.
particularly to rural and tribal broadband that occurred with the infrastructure.
Infrastructure, right. And so that I don't know the specific steps of those various implementation plans, or which oversight entities have the specific responsibility county by county within Arizona, but we know someone does, and it's just a matter of knowing who does and then intersecting with them.
Yeah, I think some of that's being run out of the Arizona Commerce Authority, but with the new administration, you guys are meeting together as directors, talking about how do you coordinate. And even, I love hearing that we lobby for food stamp. If you sign up for food stamps, you ought to be able to sign up for healthcare at the same time, because you're asking basically the same questions. So that kind of lobbying efficiencies at the state level can be very, very powerful. So I think as we roll, as Governor Hobbs looks at that landscape of implementing both the CHIPS Act and the infrastructure, that will be helpful.
Yeah.
So, any ideas from a rural standpoint? You've been using telemedicine a lot for rural healthcare delivery. That was because of the pandemic, but it's still an issue.
Right, and I really think previous administrations and lobbying work that happened to lift some of the rules and the ability to provide telemedicine that was really insightful. Several years ago, before the pandemic, some rules were changed in Arizona, some laws were tweaked in order to really help the healthcare community provide services and expand that. And it happened right as the pandemic was starting, and so it was good that some providers and hospitals, really geared up and were just ready. Of course, the pandemic accelerated that need, and really, if you were resisting telehealth, you had to jump in order to stay in business. And so this is one of those silver linings, I think, that can help rural communities. In the report, if you haven't read it, I found it alarming that it said that in urban communities, the ratio is 80 providers to 100,000 people in the population. And in rural communities, it's 10 providers to 100,000. That's a huge disparity in inequity. And one of the ways to solve that could be telehealth. And so then you need broadband. And again, in the report, it mentioned that 16% of folks on tribal lands don't have any internet connection at all. And then another group is spotty availability. And so it's a barrier that we can tackle. It's a very tangible thing that as a state, not that I know the answer, but that it seems very reachable and attainable in the near future to create more accessibility through technology. And then we just need to also do our
video conferencing even in the justice system. You have examples, you wanna share some examples of where that was useful?
Well, definitely, prior to COVID, we had created I used to be on this Supreme Court Committee on Domestic Violence, and, basically for rural communities to access the courts, and in rural communities, a lot of them know each other, so they didn't wanna go to the police station, because that's where my husband works, or he knows that's uncle, or all those kinds of things are going on. And so we had, our court of Phoenix already had where someone could go to the police station and, get an order of protection from the court. And so we use technology for them to, video conference with us, the judges, while they're at the police station. So they didn't have to fight the traffic, coming out of the stage, try to find the parking space, and all those stressful things, some of our big wonderful buildings, and not know where to go. They could be at the police station and be able to have that word, issue and have that dialogue with the court. After COVID, we realized that a lot of the court settings we were setting just really wasn't necessary. And we were requiring people to take off from work, find babysitters, or take their kids out of school, or leave work early, and all those things for, a 15-minute court session. And so we learned from that maybe that's not a good idea to have all of those court settings and require people to do. So, COVID has some positive outcomes.
I know, some of them we fought tooth and nail, but now that we got them, we don't wanna get rid of them.
Yes, yes. And court hearings were held, video. So, and that made it easier for everyone. And for the attorneys especially. We didn't have the issue with, appropriate dress. But other than that, it was a positive outcome for everyone. And it still allowed for us to keep the courts running and serve the public in the ways that we need to, but it also allowed for more efficiency.
So all three of you have had a chance to review, we got the report early, to be able to look at. Any reflections, let me start with you, Neil, from the report, and again, it's more like a workbook than a traditional town hall report, but can you see ways where you might be able to use the report maybe in conjunction with the racial equity action plan to further the conversation with the business community?
Yes, I think so. The thing that struck me was, and I think this is a good thing, there are more questions than answers, right? And I think we have to identify the questions, and the questions then become choices for society, for the institutions of society, for those of us who interact in all the different institutions of society, and we're all gonna have to be players in that, we're all gonna have to be agents of change within that, or it will just be a sport. So that was my takeaway from it. This is a signal for a lot of work that really can't be just 1 year. Right? I know you guys do a 1 year plan. The topic is for 1 year, but this really needs to be something that lives on beyond the year of the topic in specific.
And we've seen that even with the last 2 or 3 reports. We're still doing it. We get requests to talk about it, and we want to focus on one part of, so when the last one was dealing with mental health, substance use, and homelessness, so there's, obviously that's not solved.
Right.
So we've got a lot of conversation about that, and the one before was creating vibrant communities. And all of these are really tied into that more global sense of how do we create a more vibrant community or communities within Arizona. So from the healthcare perspective, looking at providers, are there ways that we might be able to use the report to engage the healthcare and what I would call the social service, the wraparound service community?
Certainly, I think that it's dialogue. I mean, right now on the panel, we identified an area where we could benefit in dialogue on justice involved and reentry and yeah, all three. So reports like this and opportunities like theirs in the town hall, it's not the immediate fix, but it's that template for it, it takes you through reflection first and then case examples, but case examples from a variety of perspectives, small to large scale. And so I think, the word equity itself, unfortunately, in the conversation we had earlier, has become a sensitive word, a hot topic word, sometimes even weaponized by certain groups. And so I think that it's those that are interested and see that, global perspective of what the intent of equity is, need to have examples of to tell the story of why it's good work and why it's not something to be afraid of or against.
In your perspective, from looking at how this report might be applicable to the legal community?
I think it is what Liza talked about earlier, this conversation started. One of the things that we've noticed with the Arizona Equal Justice Alliance is that people want to talk about this. They don't know how to start a conversation. They don't want to say something that offends somebody, so they say nothing. And what this report does is gives you that conversation started. It gives you, as Carmen said, that self-reflection first, so you know where you're coming from. You understand, helps you to understand other people's perspectives. And I like the fact that they include the other perspectives, how somebody else answers your question. And then you can see it broadens your knowledge, broadens your understanding of other people. And I think that's really where our success comes in, is when we start understanding each other or care enough to want to understand. And I think the report is that tool, gives us that starting conversation. No matter what entity, no matter what group, it gives you that place to start the conversation. And I look forward to using it in different aspects. And I hope everyone does too, because what we found is that people want to address a lot, not everyone, of course, but most people do, and they just don't know how. Some of the reviews that we got from some of the dialogues that we had was, I don't think people are ever going to change, no matter what we say or what we do. Or, this is a waste of time. Or, what do you say to the person? We'd rather not slap you in the face than to discuss equity. And so, those are real situations. And it's like, if somebody wants to slap you in the face, I think that's best not to have a conversation with that person. You move on to the person that wants to have that conversation. But the majority of people do. The majority of people want better. We want a better Arizona. We want to get along with people. And so this gives us that tool to have those dialogues.
I think that's a perfect place to close on the panel. Can we join me in thanking So all of you and those on camera have some homework. You need to read the report and look at those 7 questions that Carmen talked about and that I've mentioned that allow that reflection. And what would be great is to do it on your own and then do it in, I would say, do it in your tribe, do it in your community group and your family and friends. And the group that nurtures you is really what would be great to start. And then think about how you might answer those questions differently if you were from a different social identity. I don't know if any of you have done this. I've done this in a number of groups where we've said, play a different character, be the contrarian, or be somebody different. So step into that different role and say, how might I answer these questions differently if I were a differently abled person, or I was a young foster youth, or I was an elderly person? How might I engage in that thought process differently? And then you can just contact Town Hall to say, I want a community town hall in my area. They do have a cost to them, so we can talk about working with that. There's been great sponsors that have helped in previous years, and I think that we will see that happen again. And then I would challenge you to find your own examples of success where equity, and you've seen, we've talked about quite a few examples where an equitable practice is being implemented successfully in Arizona. So we can take best practices at times from other places, but we've also got some amazing successes here in Arizona. So I think we're gonna build on that with the discussions on the equity report and engage going further. So we can step down and we're gonna turn it back over to Evelyn.
So I'll go ahead and set the